Hello, I'm Dr. Brian Holsey from Foundations Chiropractic and Functional Medicine. Today I want to talk about neurometabolic treatment of autoimmune disorders. So autoimmune disorders are wide-ranging, and as we'll see later, they're very high on the list of morbidity and mortality in the United States. So with that, we have the third leading cause of morbidity and mortality, or decreased life in essence. So decreased enjoyment of life and decreased life expectancy. So decreased life in our years and decreased years overall. So again, what I want to talk about is our approach to how we treat these conditions. So a little bit about me first. I've been a chiropractic physician for over 10 years, but I wasn't happy with just adjusting the spine there. So I've definitely pursued more education to figure out why people hurt, why they're not getting better. If adjustments and chiropractic manipulation of the spine is very an important tool and very powerful in itself, but I wanted to figure out why some people weren't responding. And with that, I went on to further my education with Functional Medicine University, continuing ed as a clinical nutritionist. I'm a certified gluten practitioner. I'm also trained with Dr. Michael Johnson, who's the author of the book, When the Medications Don't Work. What do you do when the medications don't work? I've studied extensively with Dr. Datis Kharrazian. He's the author of the book, Why Do I Have Thyroid Symptoms When My Lab Tests Are Normal? So all those things help me to better address long-standing or chronic conditions. So much of these are autoimmune conditions, or the body attacking itself. Again, I'm passionate about getting people better that nobody else can. So a lot of the patients that I see have gone to multiple physicians, neurologists, cardiologists, nephrologists or kidney specialists, brain specialists, all of these other fields, and nobody's really been able to put all the pieces of the puzzle together. I love solving these puzzles. So if you or a certain loved one are wanting to get their lives back, and that's some of the reason why you got this DVD. So that there's three big reasons why you requested this video. You or yourself are suffering from a particular condition, rheumatoid arthritis, thyroid issues, lupus, multiple sclerosis, Parkinson's, the list goes on and on. So you yourself are suffering from a particular condition and want some answers. You want to get this figured out so you can get your life back. You just, in general, want more information on how we address particular conditions. Or you have a loved one or a friend that is suffering that you want to help. Okay? So here, what are our clinic's goals? So at Foundations Chiropractic, we have three main goals. So the first goal I want to do is reinvent your life. So with this, we need to incorporate the appropriate testing, lab, diagnostic, exam testing to figure out where your body's going haywire. So this could include the nervous system, this could include all functions of your physiology, metabolism, as well as body's energetics, or your chi in Oriental medicine. So scars and trauma can definitely throw those areas off. So I'm going to incorporate the most appropriate testing and procedures for each individual person that comes into our office. So after we get the results of those labs, we're going to custom tailor a treatment plan just for you. So again, when I say reinvent your life, many people are suffering from similar conditions as you. Not all of them have the same causes. So my goal is to figure out what are those needles in the haystack, or the straw that broke the camel's back, per se. The second goal, I want to have maximum positive impact on everybody that I come into contact with. And the third goal, I want to give you an exit strategy. What do I mean by that? So with giving you an exit strategy, I want to decrease your visits to the doctor. That's right, I want to decrease your visits to the doctor. That includes me, that includes your other practitioners that you've seen. I want to decrease your medications. I want to give you a plan that you can incorporate into your lifestyle that is going to change your overall health. And so you're not as dependent on doctors for your health. Okay, here's what is really happening in most conditions. This is staggering. So you can put your health condition right in here. This is rheumatoid arthritis or Parkinson's, Alzheimer's, multiple sclerosis, lupus, juvenile rheumatoid arthritis, diabetes, type 1, type 1.5, 2. So the list goes on and on. So why? So this is called our web of physiologic dysfunction. We have one area that's going haywire, or you have these type of symptoms, but we can have everything along this gamut. So we need to address all of these particular things. So we need to look at thyroid. We need to look at hormone balances. This includes your pituitary. If you're a woman, this includes your ovaries. If you're a man, this includes testes. This includes how your brain is talking to these particular organs. This includes liver, how well you're clearing out excess toxins and crud that we come into contact with on a day-to-day basis. How is our immune system functioning? So our immune system may be going haywire, and now this is causing our body to be attacked by ourselves. So when the immune system goes haywire, we produce cytokines. We'll see how that happens here in just a little bit. We need to look at your brain and nervous system function. So your brain is your governing organ over everything else there. So if your brain's not working correctly, then how can we expect the rest of our organs to function well to support us and so we can thrive? So cell dysfunction. A key process of this is figuring out how you're producing energy. So the body's means of energy is called ATP, or adenosine triphosphate. Now, the little mitochondria in your cells are churning out this energy. When we have a metabolic glitch, excuse me, when we have a metabolic hang-up, the ATP production can definitely be altered. So metabolic hang-up includes, back to thyroid dysfunction, it includes blood sugar dysregulation. That's one of the biggest stressors on the body. So we got to look at overall stress. Do we think we can actually get better? So that's some of the issues that we need to address too. Are there subconscious hang-ups that are causing us not to improve or not to allow ourselves to get better? So this isn't a spiritual or religious, but it's a deep down, if there's a hang-up, we need to try to unravel that. So again, blood sugar imbalances, one of the biggest stressors on the body, which is going to cause adrenal dysfunction, which could potentially cause gut dysfunction. And you can see all these different arrows going in various different directions. That could be potentially your cause of your health problem. So we need to unravel all of those things, and that's our goal at this clinic. Again, reinvent your life. So do the appropriate means necessary to get to the bottom line of these answers here. So this is an autoimmune DVD. What does autoimmunity really mean? Parts of your immune system aren't working correctly. So when your immune system goes haywire, I think of this as kind of a balancing act. So when that balancing act is tipped to one side, we can clue in one part of that immune system or another. So that, either way, that can have drastic impacts on your overall health. So the body, with an autoimmune situation, the body is attacking itself. So again, it says on here, autoimmune equals autoimmune equals autoimmune. I don't care what tissue is being attacked. These same underlying processes are happening there. So we need to address the underlying foundations there. With looking at gut function, we need to look at the blood sugar transport, stressors. All of these different things are playing into why our immune system's going haywire. So again, think of DNA. We have our DNA is our coding system there. And now how everything is presented in our body, our environment has a huge play into that. So that comes from the foods that we eat, that comes from what we eat our food out of, how we cook our food, the chemicals that we come into contact with, all of these things. So to mention chemicals, I recently had a patient who was a caddy and exposed to a lot of chemicals on a golf course, the pesticides and things to make those things green. He was constantly having balls picked up off of that. His body couldn't handle those pesticides very well, so he started noticing a reaction there. So our goal is to, one of the things that we needed to figure out is what was he reacting to. So with this, we mentioned DNA already. The DNA, think of it as a light switch that gets turned on. This DNA starts making proteins that code for inflammation. And now we can start, this inflammation now it starts attacking particular tissues in our body. If it's joint, that could be rheumatoid arthritis. If it's our pancreas, potentially diabetes. If it's our thyroid, we potentially have a Hashimoto's or Graves incidence there. So if it's our brain, it could be any number of childhood neurologic disorders. It could be brain fog, easy brain fatigue, Alzheimer's, dementia, Parkinson's. So all of these things are thought of as autoimmune conditions. So the body is attacking itself because we lose the idea of what's self and non-self. What else do we know about autoimmune disease? It's definitely on the rise. So it's not going away anytime soon. There's a lot of ideas of why this is happening. Why do we have this increase? Is it preservatives in our vaccinations? Is it, again, the foods that we eat? Is it how food's handled? Is it genetically modified foods? Is it the containers that we put our food in? Is it plastics? Is it all of these things, again, include, that make up our environment. So when we have our genotype, which is our genes, and environment, those together we start expressing as our phenotype, or what's actually going on with us. So diseases that we might manifest, heart disease, again, those are some of the things that we've talked about. Early on we mentioned that autoimmune diseases are the third leading cause of morbidity and mortality in the United States. So with that, they're close behind heart disease and cancer. And they're finding that heart disease and cancer also have an immune component to it. So we can say the third biggest killers of life expectancy and life enjoyment, fulfillment, are heart disease, cancer, autoimmune conditions. Those are all immune system related. So if we get a good idea of what's going on with the immune system, we can help with a variety of different conditions there. So again, with autoimmune conditions, our immune system is mistakenly attacking our own body and our own tissue. It is making autoantibodies. So what is now our self is recognized as an outside invader or outside pathogen. So we're not distinguishing well between self and non-self. Take a quick breather here. Let's get caught up. I'm going to take a drink of water. Okay, I don't want you to get bogged down in how this happens, but this is the underpinnings of how most conditions, most chronic conditions come on. So the autoimmune system is composed of three big parts. So our first part are our barriers. So we have natural barriers, the skin. So if we get a cut in our skin, things can get in. We have our lungs. So coughing and sneezing help get stuff out. We tear from our eyes. We have nasal mucus that helps get rid of stuff and trap pathogens. So as well as we have our gut barrier. When any of these are disrupted, think of a barrier as a wall. We start hitting it with enough things, that barrier could break down. So when we have breakdown of that barrier, we have now can start stimulating and aggravating the immune system. The immune system can go haywire here. So one of the big things, I mentioned that gut function is huge. Think of this as our inner skin. So we get sunburned, we see that it's red, it gets inflamed, it hurts there. Our gut doesn't have, especially past our stomach, doesn't have too many pain fibers there. It can feel stretch, and it can feel bloat, and it can feel a lot of, if you get a lot of grumblies and bloat and all of that kind of stuff, that's more of an indicator of immune dysfunction or the gut going haywire as is constipation, diarrhea, reflux. So those are the indications of the gut going haywire rather than outward pain there. So what happens, so this is a big long food tube, and we get this food coming in, and if this food's not broken down well, let's say we eat too fast, we're stressed, well, our stomach's not producing enough hydrochloric acid to help break down protein there. We don't chew it well enough. We're rushed. We're stressed. We're producing too much acid, so we get irritation of the stomach. Any of these things can cause too large of food molecules to enter the small intestine there. So when this happens, the food isn't typically absorbed, and it could get out in the stool. But over time, we can actually get degradation or breakdown of these cells. So we have these finger-like projections on our cells of our small intestine. The cells of our small intestine have these things called villi. No, we should filter food in through these villi. If that doesn't happen, well, it's going to go to these spot welds in between the cell and could potentially break those down there. So again, stress, alcohol, caffeine. Stress is any change from normal physiology. We have antibiotics, long-term antibiotics that's killed off the good guys that help line our flora there. We have decreased digestive enzymes, so we're not breaking things down well. So these cells get pried apart here. We start getting that to open up. And now a lot of our undigested food or some of these pathogens have a way of getting in here. So this is our bloodstream right here. Now this undigested food enters the bloodstream. Think of a robber or a burglar breaking into your house. So we've gotten past our first lines of defense. We got past that barrier. Now we're on high alert. We're calling in the SWAT team. We're calling in the fire department to help knock these guys out and take them out. But the immune system now gets aggravated. It starts sending out screams for help. These screams for help are called cytokines. Now when we start sending out these screams for help, it produces inflammation. We can get localized inflammation here and start degrading these villi so we're not absorbing things as well. You know, fold degradation of that can be thought of as celiac disease with a reaction to gluten, but also an inflammatory bowel disease, Crohn's disease, ulcerative colitis, other types of colitis. These inflammatory bowel conditions, we get decreased absorption, so we can have loss of nutrients in the stool there. So those are going to cause another host of problems there. So we get this immune system activated. We send in the SWAT team. We are screaming out for help. This is inflammation, so we're bringing in more players into the game here. We also send messages to the police sketch artists. Be on the lookout for anything that looks like these things that have come in. Now, when these things are coming in, that again is setting off the immune system to bring in the SWAT team. We got to call, now we're sending out the police sketch artists. Remember this guy. So it's now on the lookout for anything that looks like what has broken in. That could be, that's how in turn it becomes our own tissue there. So this bloodstream, where does blood go? Blood goes everywhere. Now the same filtering mechanism, these spot welds in the small intestine are the same spot welds that are in your blood-brain barrier. We get a breakdown in the small intestine, that's going to cause this to open up, and now we can get increased inflammation into your into your brain. So again, what is that going to look like? It could look at brain fog, it could look like easy fatigue, it can look like depression, it can look like a whole slew of mental disorders, childhood neurologic disorders, Alzheimer's, Parkinson's, other dementias. So again, we have to look at gut function. Okay, so now we're in the gut, we're in the bloodstream. This antigen-presenting cell, usually a phagocyte or dendritic cell, this latches on to our invader. It gobbles it up and it shows it to the immune system, our T helper cell. Now the T helper cell decides what to do with this. Do we need to send in the SWAT team, our natural killer cells, and our cytotoxic T cells, and we're calling our police sketch artists. This police sketch artists are B lymphocytes, and they produce antibodies. to those particular foods. Now we can keep this in check fairly well with these regulatory T cells. When the regulatory T cells start dysfunctioning because of decreased essential fats, because of decreased vitamin D, decreased antioxidants like glutathione, that can cause tipping of the scales. So we have certain blasts of this, and glutathione jumps on the particular antigen, the stressor, the heavy metal, the whatever, and it tries to quench that. Now, the T regulatory cells or regulatory T cells are having a harder time to keep this balanced. So now we start shaking and tipping the scales there. So when we start tipping the scales, we can create a dominance. So now we're sending in the SWAT team when we don't need to, or we're starting to tag things that we shouldn't there. So when we start tagging things that we shouldn't, that is, we start breaking down our own tissue, and that can lead to destruction. But when we look at this, we can have an autoimmune process long before it's called long before enough tissue is lost to call it an autoimmune disease. Okay. So when we have these hitmen coming in, so this is where some of the factors like Humira and some of our new autoimmune type drugs come in. They break down this TNF-alpha. They're called TNF-alpha inhibitors. So they stop this whole system. So they prevent these cells from coming in. So this can have drastic responses on it if we're shutting off this whole side of the pathway. So now this guy can start going haywire. When this system goes haywire, this opens the doors possibly for tumor production, cancer production there. So these natural killer cells and cytotoxic T cells are some of our defense mechanism against cancer. So we get the antigen presenting cell binds with this T helper cell, and we get interleukin 1 being produced. So further down the line, now we have gamma interferon. This is coming from our Th1 side of the picture, and we also have interleukin 4 and interleukin 6. They start stimulating what's called a Th17 cell, or T helper cell 17. This T helper cell now produces and starts churning out a lot of interleukin 17. This interleukin 17 acts back on the Th17 cells, causing it to produce more there. Interleukin 17 now engages in what's called inducible nitric oxide synthase production. This inducible nitric oxide synthase is some of what leads to tissue destruction. So we get inducible nitric oxide synthase, not to be confused with our good guys, endothelial nitric oxide synthase, that helps blood vessels open, and neurogenic nitric oxide synthase, or nNOS. This helps send feelers out from different neurons, and they can make connections there. So we want increased blood flow and more nerve connections in most situations. Again, in cancer, we don't want more blood flow to that tumor because it's going to cause overgrowth of that tumor, and it's going to take over. So now over time, we get this inducible nitric oxide synthase being produced from interleukin 17, and when we get a tissue breakdown and it's called cell apoptosis, or programmed cell death. The tissue is pretty much taking itself out of the picture. So over time, this is going to lead to decreased thyroid function, or my blood sugar is starting to creep up and up and up and up. So this could be, it's called LADA, latent autoimmune diabetes. So it's called type 1.5 diabetes. Type 1 diabetes, usually there's some kind of challenge to the immune system. It could be a virus, it could be anything like that, but the virus starts attacking the pancreas, or it causes the body to attack the pancreas. Now the pancreas houses the cells that help produce insulin there. We could also have antibodies to intrinsic factor, which help absorb B12 in the stomach. So many different tissues, you name an autoimmune condition, this is probably what's going on with it. Factor here, interleukin 6, it can react back here on our regulatory T cells. So when that happens, we get further imbalance. So the body's churning out this gamma interferon, interleukin 4, interleukin 6. This is going to cause further imbalance of the immune system. So we need to figure out ways that we can knock those down. So again, overall, this leads to tissue destruction and cell death. So we mentioned our cytokines. These are our body's screams for help. This is what happens when our system becomes polar. We get our Th1 system out of sync, but we get these out of sync, we get more production of interleukin 17, and we get more tissue destruction. So what are some of the reasons that causes the immune system to go haywire in the first place? We've seen what happens when the immune system goes haywire. We got a laundry list of conditions. So the past few slides we've seen how the immune system is supposed to function and what happens when it starts going haywire. But why can this happen? So we get blood sugar dysregulation. I've already mentioned that this is one of the biggest stressors on the body. So we get this blood sugar dysregulation, either hypo, too low blood sugar, or hyperglycemia. This can lead to insulin resistance and diabetes. Again, this is the biggest stressor on the body. All of our tissue, all of our cells in our body require an adequate supply of blood sugar to function normally. Again, this helps keep those ATP or mitochondria producing ATP. So we have exhausted adrenal glands. Adrenal glands respond to stress. So stress is any change from normal physiology. So we get stress from emotional sources, chemical sources, physical sources, trauma, pain, injury. We have a family, we have a job, likely there's emotional stress going on there. And now we have some of these chemical stressors going on. We're eating things that we're not supposed to. We're exposed to a lot of environmental chemicals. So the containers that we put our food in, it could be altered EMFs or electromagnetic fields. So this is going to cause stress on the body. The adrenal glands produce cortisol, epinephrine, and norepinephrine, as well as a hormone called aldosterone that helps with mineral and fluid balance there. So when we have too much cortisol, this can start breaking down our body's immune system. It could also start breaking down our function in our brain. So it affects the hypothalamus, which is on the highway to from short-term memory to long-term memory. Too much degradation of that area, and what that can cause, or too much degradation of the hippocampus, that can potentially lead to Alzheimer's. So we have exhausted adrenal glands. We have hormone imbalances. Usually this coincides with blood sugar dysregulation and exhausted adrenal glands. In men, the most common hormone disruption is testosterone conversion to estrogen because of inflammation and blood sugar surges, insulin surges, cortisol surges. And in women, the most common is increased estrogen conversion to testosterone. So when we have too much estrogen in our body, either our body's not clearing it well because of liver issues, that is going to estrogen, insulin, cortisol, those three are going to cause increased deposition of fat or increased fat deposits. Now that fat in turn can produce more estrogen. So that starts going haywire. We get too much production of estrogen. We start gaining weight there. So we need to look at hormone imbalances. And we need to look at neurologic imbalances. Have we had a head trauma that's now causing certain areas of our brain to malfunction? Or is the brain underfunctioning in certain areas? So the brain also governs what's called our enteric nervous system. Our enteric nervous system gives supply to all of our internal organs up to the bottom part of the colon there. So when we have brain that's out of sync, we can have neurologic imbalances that create organs that may be underfunctioning. So how do we figure this out? We need to do proper testing. So we need to test for these things. We need to look at blood sugar dysregulation. We need to look at cortisol. We need to look at hormone imbalances. We need to look at how your brain's functioning. That's going to be the purpose of your first visit with us. Some other reasons why your immune system would do this. We have an active antigen, which means the immune system has been turned on. This is causing an imbalance. Our body's being attacked due to inflammation. So we can have a parasite or a bacteria, a yeast that shouldn't be there. This could be a dental infection. So we need to examine your teeth and see if any of those are testing weak. This could be a parasite or bacteria in your gut. We need to do a stool analysis to see where that may be coming from and what that critter is and how to adequately address it. Is it a food sensitivity? Again, everything that we put into our mouth can and will affect how the rest of the system is functioning. And we got to look at environmental toxins. One of the biggest ones is mercury. That could be coming from potential vaccinations, or if you have any metal in your mouth, that can the mercury can be broken down, and now we're constantly inhaling those fumes. As your body's exposed to more of that, some people have decreased ability to clear out these toxins in the first place. So that could be some of it. We have congestion in the liver. Liver doesn't function as well as it should, so we have an accumulation of toxins in the body. And then, again, undigested food, which goes back to our leaky gut idea. So we talked about heavy metals as part of being one of the #1 environmental toxins. We have to do proper testing. Again, I don't know what to address unless we have all the pieces of the puzzle here. So we got to look at, here's a quick breakdown. Let's take a break here for a second. So we got to look at triggers for autoimmunity. So almost always includes leaky gut syndrome or intestinal permeability. We get this gut overfiring or this leaky gut happening. This starts stimulating the immune system or aggravating the immune system. We get this imbalance, which leads to tissue destruction. Now this imbalance is due to usually to poor regulatory T cell function. And remember, we need vitamin D, antioxidants such as glutathione, and essential fats coming from like avocados, nuts and seeds, coconut, fish. That can cause the regulatory T cells to become dysfunctional. Now we get activation of that Th17 cell. This Th17 starts churning out a ton of interleukin 17, and we get activation of this inducible nitric oxide synthase, or INOS. So this Th3 regulation, we're going to get more imbalance of our Th1, Th2 system. We're going to get more activation of our Th17 cells. This is going to cause a churning out of interleukin 17, and now also produces inducible nitric oxide synthase. Remember back to the skull and crossbones, this starts causing the cells to take themselves out of the picture. So we start losing cell function, and now we have less tissue to function over time. So I keep pointing to thyroid. Thyroid is the most common autoimmune condition that there is. So we get tissue destruction, severe tissue destruction. This adds on to dysregulation here. Now here's the scary part. Now, I already mentioned most of your immune system lines your gut. So again, everything that you take in to your mouth can impact the immune system's function. So what the literature is now saying is that leaky gut syndrome is a prerequisite to autoimmune disease. We get breakdown in the gut. Now these things start these burglars get in, they start stimulating the immune system. The SWAT team and the police sketch artists, they start churning out more and more inflammation. This inflammation's in the bloodstream. All of these things are going to go to our tissues. There, so things that are heavily bathed in blood, that these are going to react, these are going to be more likely to react first. That's some of the reason why thyroid disease is rampant. So again, intestinal permeability, think of it as a screen that we have. We should be filtering things through that screen. Only a certain size thing can get through that barrier or through that screen. When we have intestinal permeability, we have a tear in that screen. So we're going to try to break this down for you. We get gut inflammation. This usually comes from an immune reaction to a food or possible infection. Bacteria, parasite, yeast overgrowth, all of these things can come from being stressed, our diet, heavy sugar diet, being acidic in general, too many antibiotics. So now we get production of inflammation. This leads to leaky gut. There's probably some of you out there that can't really eat anything. You really fire up to anything and everything. This is going to lead to more and more food sensitivities. So now this inflammation can cross the blood-brain barrier. We get into the bloodstream. We have this. We have breakdown of this. And we're into the bloodstream now. This starts going through the body. If we have breakdown of this, it's the same things that help hold this together. We're going to get breakdown of that. So that's the way we start getting things to go into the immune system. It goes through the bloodstream, it goes to the brain. We start activating the immune cells in the brain, or our microglia. These microglia now are going to cause inflammation in the brain. So we have fire in the gut, likely we have fire in the brain. We need to address gut function, get inflammation down to help with a brain issue there. Depression, brain fog. Fibrofog is another coined term. Alzheimer's, Parkinson's, the childhood neurologic disorder. So we have to look at the gut in order to also fix the brain. A common treatment for autoimmune conditions is using steroids, corticosteroids. What this does is just drops a big old bomb and wipes out the whole immune system. Now there are a few more specialized drugs now, like Humira. That's a big one. That is a TNF-alpha inhibitor, or shuts down our Th1 side of the thing. So now our Th2 side of the things can proliferate. Most tumors and cancers are Th2 dominant. So if we allow that to proliferate, what's that going to do to our chance of possibly getting cancer? It's going to increase it there. So there's got to be there are other options. So we got to look at what are the triggers. Is it food? Is it an environmental toxin? Is it decreased organ function? Is it a mesh screen that's been implanted, to help with the hernia repair? Is it a tooth there that might have an underlying infection? And we need to figure out what polarity you are. So again, we try to figure out what dominance we are. We need to support. This is probably the biggest one, supporting our regulatory T cells. Again, vitamin D, adequate vitamin D. We live in the Pacific Northwest, so our vitamin D is activated by the sun. The sun goes and hides 9 months out of the year here. So most of us are deficient in vitamin D. So we need to look at vitamin D, we need to look at antioxidants such as glutathione, and we need to look at essential fats. So from coconut oil, from fish oil, krill oil, also from nuts and seeds, avocados, from the foods that we eat there. And we need to shut down this inducible nitric oxide synthase. So arginine is a popular supplement right now to help increase nitric oxide. But what's going to happen is going to increase all three types. So inducible nitric oxide, which is the bad one, as well as endothelial nitric oxide, which is good, as well as neurogenic nitric oxide. We need to find a way that we can knock down the bad one and increase the good. So we've got to remove the triggers. We've got to heal the gut. We need to look for infections. We've got to stabilize blood sugar. We need to stabilize cortisol. We need to check for food sensitivities. How do we do this? Again, we've got to do proper testing here. It sounds like a lot. It is. You've been dealing with this condition for who knows how many years. You're tired of suffering. We got to do more to figure out what's at the heart of your condition. So again, to support the Th3 system, our regulatory T cells, vitamin D, glutathione, our antioxidants, essential fats, nitric balance is another product there, again, that helps knock down inducible nitric oxide synthase, increase endothelial nitric oxide synthase, increase blood flow, perfusion, as well as neurogenic nitric oxide synthase. So glutathione and nitric oxide, these are the most potent So glutathione is the most potent antioxidant in the body. So it helps with liver function. Again, we talked about nitric oxide. It causes the immune system to go haywire and take tissue out of commission. But it can be good too. And endothelial nitric oxide, that's present in all of our blood vessels. That helps open things up and increase blood flow. So if you have cold feet and hands, that could be a bad perfusion issue. If male, female with sexual dysfunction, that could be a blood flow issue. As well as if we have brain fog, we're not functioning well, we're constantly trying to find words there, we're stumbling over words, we're tongue-tied, that could be a blood flow issue. So we need to work on increasing blood flow and nerve flow. So how do we address AI? So we've gone into the idea of metabolic dysfunction. So again, at Foundations Chiropractic, we need to look at the brain and nervous system function, we need to look at metabolic function, and we need to look at your body's energy flow or your chi, and anything that might disrupt that. So number one, we need to look at brain and nervous system. I got a question for you. So 30% of our energy goes to what system? I gave the answer away already. We're talking about the nervous system. So basically what happens, we're looking at neurologic function and we're looking at metabolism. Metabolism is the process of eating food, breaking food down to get energy. So the energy again is ATP. Now when we have adequate levels of ATP, we're feeling pretty good, our body can function as it needs to. Now, 30% of this energy goes to supplying the brain and nervous system. So the brain is the most needy and greedy organ in the body. So when we have brain fatigue and misfiring, this could come from stress, this can come from trauma, this can come from any one of these things. We can possibly get brain dysfunction. This can cause brain, so your brain is wired into everything else. So if you think of the idea of radio, we have a receptor, and it starts from above, it goes down, inside, and out there. So we need to check into all of these different types of sensation. We need to look at how muscles are firing, how is joint position sense, can you balance on one foot, how is light touch, how is vision, how can you coordinate movement. So there's two receptors that light up the brain the most. It's touch and gravity there. So chiropractic, massage, acupuncture, all of these help. All of these are big drivers to the nervous system, as well as we're constantly battling, this is the biggest one, we're constantly battling gravity throughout the day. So when we're battling gravity, all of these position sensors are telling us where our body is in space. So we have our inner ear telling us, you know, are we lying down, are we turning, how fast we're turning. So our brain interprets all of this. When one of these systems starts going haywire, if you've had an inner ear infection or you suffer from vertigo, this can cause you to cause a disruption in how your brain's perceiving where you're at. You're getting miscommunication between your eyes, your inner ear, and what your body's telling you. If you get motion sickness while driving, it's usually because you're sitting, we're not getting any input from our proprioceptors, our position sensors, and our head's not moving typically, maybe checking blind spot, but we're getting all of this information flying by us and causing our eyes to give different information than what our inner ear is telling us and what our position sensors are telling us. So we got three main parts of the brain. So we've got our cerebellum, which is at the base of the brain here. We got our cortex, this is our cerebrum, this is called the brain, and then deep inside here we have what's called the midbrain. So everything that comes from, all sensation that comes from one side of our body, it goes to the cerebellum, which is our relay station, and now is sent over to the opposite brain, where the brain interprets where that sensation is coming from. It also tells us what type of sensation it is. Is it pain? Is it cold? Is it sharp? Is it vibration? Is it moving on my skin? Do I need to get away from it? So those are the three main parts of the brain. So the cerebellum, all of our information goes into one side. It goes over to the opposite side of the brain. And now that brain, most of its function, 90% of its function, is to shut down our brainstem. So, or to inhibit our brainstem, our midbrain, mesencephalon. So if that's not happening, we get more of a primitive response or fight, flight, or freeze response to our environment there. So we may be more prone to freaking out or really anxious or stressed. So this is going to be our sympathetic nervous system that is overfiring. What can this lead to? It can lead to chronic pain, chronic fatigue, irritable bowel syndrome, urinary tract infections, fibromyalgia, migraines, poor posture. We start walking around like Bigfoot there. So we get adrenal gland stimulation. So again, this is our fight, flight, or freeze response. And so we get adrenal gland stimulation, we start churning through blood sugar. So it's hard to regulate our blood sugar. We feel like we always have to eat to stabilize that. We can also get blurred vision, increased sweating, like palms of our hands being wet all the time. We can have difficulty falling or staying asleep. So falling asleep is usually an indicator of too much cortisol when you go to bed. And staying asleep is maybe our blood sugar is dropping too rapidly. So we get the stress response that we wake up and our body is telling us to move, to get something to mobilize blood sugar. We can get dizziness or vertigo. We can get heart palpitations, increased heart rate, high blood pressure. We got to check blood pressure on both sides of the body. We can be cold hands and feet. We can have sensitivity to light and sound. That typically this plays into like a migraine situation where you have to hide in a dark room. So if we get the cerebellum to crap out on us or poop out on us, we're going to have balance issues because we're not integrating well there. Our inner ear talks to our cerebellum. Our position sense talks to our cerebellum. We can get now these muscles, the cerebellum is coordination of movement and how our muscles are firing. Depending on what part of the cerebellum is malfunctioning, whether it's middle, that relates to our spine and eyes. If it's intermediate, it could be our shoulders, elbows, hips, knees. And if it's the lateral part, it could be into our hands, feet. So depending on what area is going haywire, we can have chronic pain in those areas. We can get headaches. We can, again, if our lateral cerebellum is not working well, we're going to be clumsy or possibly drop things because we're not coordinating how we should. We can have disorganized thinking. Now, this is very common that midline cerebellum isn't functioning well in children with ADD, ADHD, autism spectrum disorders. So now our brain's not functioning well, our upper brain. So we can't govern, our governor's not working well. So we get a lack of output to the frontal lobes, the parietal lobe, and the temporal lobe here. Let's just recap that one more time. So the cerebellum communicates with the opposite brain. Most of its projections go to the opposite part of the brain. And now that cortex goes to knocking down the overfiring mesencephalon. So what happens when we have the frontal lobe, parietal lobe, temporal lobes fatigue? Again, we get inhibition, the lack of inhibition of the sympathetic nervous system. So our fight, flight, or freeze response is going crazy, is going nuts. So that's going to keep us awake. That's going to cause us possibly to sensitive to light and sound. It's going to cause easily fatigue, easily irritable. So we wanted some of the ideas here. When we get into fight or flight mode, we want to run from it, we want to kill it, we want to eat it, or we want to mate with it. So those are the big factors that come in with fight or flight. So this upper brain fatigue can lead to, depending on what part of the brain is going haywire, it can lead to depression and anxiety, difficulty scanning pages while reading, difficulty with math, difficulty expressing ourselves verbally, difficulty in understanding body language, decreased memory. So we're having a hard time remembering where we put things. We're having a hard time taking new memories and new thoughts and ideas and storing it there. So we can have learning difficulties, lack of focus, altered sensation. We get some numbness, tingling, chronic pain. Our handwriting may change. We may be angry. Think of Incredible Hulk. We can have increased irritability. We may have body weakness, a lack of motivation. So again, if this is frontal lobe, we're going to have lack of drive. So this can definitely play into motivation, libido. We mentioned learning disability, not only ADD, ADHD, autism spectrum disorders, but dyslexia as well. So how does this happen? We have stress. So we have chemical stress, we have physical stress, and we have emotional stress. This is going to cause the brain to fatigue easier. When the brain fatigues, now we have fewer nerve impulses. So this is called a decreased frequency of firing. And again, depending on what part of your brain is not firing as well as it should, that can start leading into some of your symptoms that you're having. So chemical stressors, we need to look at fuel delivery. So too little oxygen coming from anemia, a blood sugar imbalance coming from glucose too low or too high. We have food sensitivities, we have immune system out of balance. So this starts playing into our second area, our metabolic area. We have a poor diet. This is going to lead to inflammation. We have trauma. This can cause more inflammation. We have low thyroid function. We're on medications. So a lot of these are blockers, inhibitors, or reducers there. So that's going to decrease our body's function. We have chronic inflammation, maybe coming from a hidden infection in the gut or a hidden infection in a tooth there. So again, these are metabolic issues that create nervous system imbalances in the brain. We've talked about metabolism. It's taking food, converting it to fuel. 30% of that fuel goes to fueling the brain. And emotional stress. So this is going to lead to adrenal gland dysfunction. So this is going to cause increased cortisol levels potentially, and this can cause increased glucose levels. This is going to cause blood sugar dysregulation. So the brain and cerebellum need fuel, and we need activation. We need good glucose coming from the food that we eat. We need to stabilize that between 85 and 100, and we need proper oxygen, as well as we need activation of the brain. We need to stimulate those areas that aren't functioning well. Again, part of our first exam is trying to figure out what areas of your brain aren't functioning well. Step 2, we got to look at metabolism. So we looked at some of those chemical stressors already. So the chemical stressors that we need to look at, blood sugar issues, adrenals, food sensitivities, infections, all of those things that need to be taken into account. I see this is some of the reason I got into functional medicine. I see this time and time again. Oh, I had some lab work done. The doctor says everything's normal. Maybe my cholesterol is a little high. It's not normal. So I got tired of hearing that all my lab tests were normal. So that led me to investigate functional medicine more. So these lab ranges are huge. They're very broad. So what we need to do, we need to look at a functional lab value to reveal why you're having certain symptoms. So here's what we're looking at. So when your doctor, your traditionally trained medical physician, looks at your lab values, we're only looking way out here and here. So low end and high end. These green areas here, that's when we start having symptoms. That's outside of our functional range. So what we need to do is figure out our range here and look at our lab values that way. So that's another thing that we do. We take into account what our optimal values are, and as opposed to the lab values or the clinical values. So once you start getting outside of these functional ranges, that's when you start having symptoms. That's why you feel sick. So here's an example of these. So glucose, the traditional lab range is 65 to 110. Our functional range is 85 to 100. So it's more truncated or closed down, not as broad. So if we have a result of 73, in a traditional term, that looks normal. But in a functional range, that is low. That's a low blood sugar, hypoglycemia. So our TSH is another example. Here, I've seen 0.5 to 5.5. 0.5 to 4.5. Normal range is 1.8 to 3, or a functional range is 1.8 to 3. So this can give us an early indicator of gland, organ dysfunction, system dysfunction. That we have issues with cholesterol. That gets a bad rap. I can do a whole other video on cholesterol by itself. Cholesterol, if it's too low, now we're going to start disrupting your hormones there. Testosterone, estrogen, progesterone, all have a backbone from cholesterol. So if we start getting cholesterol too low because of a statin medication, we're going to start seeing hormone issues. Males with decreased drive, women being more maybe off the edge, hot flashes, hot surges, difficulty with menstruation. So that definitely can come into play. And the last one, we're still looking at fuel. So anemia is a decreased ability of your body to produce red blood cells. Red blood cells carry oxygen throughout tissue. So again, oxygen and glucose are our two main fuels to help the mitochondria produce ATP. So again, based on your history, we may run any of the following tests. And we need to look at them through functional values, not traditional lab values. We're going to do a CBC. This includes a hemoglobin A1C, a white blood cell count, red blood cell count, white blood cell differential platelet count. We need to look at blood chemistry, vitamin D, thyroid hormones. I've got another video on thyroid if you want to know how the thyroid can be impacted there. We also need to look at salivary hormone testing, cortisol, sex hormones. We need to look at critters there. And one of my favorite tests right now, it's called Cyrex there. So Cyrex does food sensitivity testing to gluten and gluten type foods, mostly grains, but also in their dairy, eggs, soy, corn, which is a grain, not a vegetable. So we see how the body's reacting to those particular things. We need to look at leaky gut syndrome. Are we attacking this? Do we have critters here that are producing biofilm called lipopolysaccharide that's now getting into the system? Or are we breaking down the structure of the cells? So, and then we can also check to see if you have markers for attack on different tissues here. There's like 96 different tissues that this is checking for. So this gives us a huge idea of which tissues are being destroyed. Number 3, now we need to look at body's energetics as well. This is part of the first visit. We look at a body's energy flow throughout the body. This is based on acupuncture as well as Ayurvedic medicine. So we look at body's meridians, so our lines of energy flow throughout the body, which can be disrupted by scars and trauma, be it injection sites, episiotomies, epidurals, gallbladder surgery, scar to the head, blow to the head. Dental infections can definitely throw off the meridians. So all of these things need to be addressed. So we utilize a technique called quantum reflex analysis, or QRA. So again, we use the body's energy fields or paths to see if certain organs or glands are weak or under functioning. Scars, traumas, sites of needle injection, episiotomy scars, C-section scars can definitely cause the organs and glands to become weak because they're creating interference fields. So we need to address that as well. So the threefold approach, we need to look at how the brain's functioning, we need to look at metabolism, and we need to look at body's overall energy flow. This is the only way the body can heal from anything. So we need to look at those things, and hopefully you're getting an idea that, wow, this guy is not like my standard practitioner. So we need to bring all of these things in, a more holistic approach rather than a systems approach. So some of these spots that we check are GD20, hypothalamus is here, pituitary is here. We look at thyroid, we look at cell energy points, sleep points. We look at certain glands, parotid gland there, thyroid, our thymus, heart points, and over here we look at stomach point, our small intestine point. This is our possibly a uterus prostate point, ovary, testes. You get the idea. We have multiple points throughout the body that we need to check and look for weakness there to see if they're being sedated by scars or injuries. So we need to address those as well. Okay, this brings us back to the big picture idea. What's really going on? So we went in extensive detail about brain and neurotransmitter dysfunction, all of our different ways our body can go into dysfunction from a metabolic perspective, as well as mind-body issues. So all of these factors need to be taken into consideration in order to fully get out your health problem. So hopefully you've seen a little bit again on what makes our office different there. If this is striking a chord with you, really think hard about scheduling an appointment here. Again, what makes our office different is that we're not going to leave any stone unturned there. We want to find the exact cause of what's going on with your condition. We may need to refer you out to a biologically oriented dentist to help with mercury removal in the mouth. Or if you've had root canals, now that's a new pathway for pathogens to get into the body there. What's next? You've heard all of this information. Hopefully, watch this at least once or twice. Sat down with your spouse, a loved one, and wow, this guy, he really wants to help us. So again, that's my goal. I want to reinvent your life. I want to have maximum positive impact on everyone that I come into contact with, and I want to give you an exit strategy. How do we get out of this pattern? We got to make a change. So we got to make lifestyle changes. We got to be willing to do this testing to figure out what's going on. So what's next? You need to make an appointment. Ask yourself these questions though. On a scale of 0 to 10, what is your rate or desire to get better? How passionate are you about getting better? I'm very passionate about helping people, and I know that we can help you improve. Ask yourself, how has your condition affected your job, your finances, your relationships with family and other activities? Are you living life? Are you getting out and doing the things you want to do? Or are you prolonging death? So ask yourself that question. What has it cost you in terms of time and money and happiness and sleep? You know, again, are we prolonging our life, or prolonging death? I want to add more life to your years there, and probably more years to your life as well. If you don't do anything about this now, where do you picture yourself in the next 1 to 3 years if your problem is not taken care of? What is it worth to you if we can improve your condition? Ask yourself that. Is it playing with your grandkids? Is it having children? Is it getting out and walking on the beach? Is it fear of going out to the store because you're not going to be able to make it to the bathroom? So ask yourself, what is it worth to be able to go out and enjoy life again? So I said, what's next? You need to make an appointment. At that first visit, what's going to happen? We're going to do a complete exam. We're going to listen to your thyroid. We're going to do a complete neurologic evaluation. We're going to do a QRA analysis. I want you to bring in any existing labs. We're going to review metabolic assessment forms and neurotransmitter assessment forms. So these are going to be forms that you'll get in your new patient paperwork there. I want that in before your first visit. I want to be able to review this information with you. If you can have a spouse or a loved one there at that first visit, that's better, but it doesn't have to happen. On the second visit, now we're going to review everything that we talked about in the first visit. We're going to review our exam, our neurologic findings, and review all of these assessment forms. If I accept your case, this is a big if, I need to see a level of commitment from you. If I accept your case on the second visit, we're going to overview further testing that needs to be done. We're going to overview your specific treatment plan, and we're going to review our financial obligation. A lot of times insurance doesn't cover this work there. It doesn't mean that it can't be affordable for you. At the second visit, we must have a spouse or significant other there. I typically only accept 5 new autoimmune patients per month. I love working with a variety of different conditions: childhood neurologic disorders, diabetes, thyroid issues, fibromyalgia, peripheral neuropathy, chronic pain. So I like to see a lot of different conditions. Usually these first visits cost you $450. Because you're taking the time to watch this video, I want to offer the first 2 visits to you for $125 today. So if you call, schedule an appointment, say you watch the video, we'll get you in for these first 2 visits for $125. We'll see if you're a candidate for care, and we'll outline on that second visit what it's going to take to improve. Okay. Again, don't forget to mention that you watched this video. That's the reason why you're calling. It's going to knock down the price to $125 there. So that first visit, we absolutely need to have shirts and shorts so we can examine all of our sensation pathway. We're going to sit down and talk. We're going to check blood pressure on both sides. We're going to check your perfusion. I want to see, I'm confident I can help you there. So please don't hesitate. If this is striking a chord, call today. Call today. 503-349-3024. So again, our level of commitment, this is what has to happen. We didn't get this way by changing our lifestyle. We probably tried, but maybe have failed along the way. So I'm going to be your coach there. But you have to be willing to make change there. I don't want to throw you a lifeline and pull you in kicking and screaming there. So if I'm going to get resistance on all levels, I'll sense that on our first 2 visits. So you got to be willing to make lifestyle changes. The more sick you are, probably the more drastic change is going to feel like. You have to take accountability for your health. This isn't the government's fault. This isn't your insurance's fault. The insurance and government didn't pay for your car, so they're not going to really help you get better there. So insurance and Medicare may pay a small portion of this. Your insurance varies. Everybody's insurance coverage varies for chiropractic care. We're going to call and check on what it covers. If you don't have any insurance, we do offer different plans here that make our care very affordable. We can usually get the care for a good majority of our patients to $150 to $300 a month. So again, call us, give us a chance. I want to help reinvent your life. Thank you again for taking the time to watch this video. Take as many times as you need to adequately take in the information. Watch this video with family and see if this is something that you and your loved ones can help support you with. I'm Dr. Holsey from Foundations Chiropractic in Corvallis, Oregon. Please don't hesitate to call if you have any questions. Our email's here on the screen, foundationschiropractic@gmail.com. I look forward to helping you get your life back.